viewers, welcome to the show. I am Shivani Thapa Bosniath with you with this pandemic special, which we have been running for quite some time now. Now, today in our studios, we have from among the major stakeholders who stands at the central of all this. That's the World Health Organization. Now, the last time I held a quick talk with World Health Organization, the emphasis was laid on public compliance on the health safety protocols. Today, the scenario has completely changed with the statistics talking a very, very different language. Therefore, we would be dealing certainly with the current state of affairs and also the future course that we can anticipate. And to talk on this, we are having here in our studios the WHO representative to Nepal, Dr. Jas Vandelier. Welcome to the show, Dr. Jas.
Thank you very much. Namaste.
Right. Well, a quick look and a study of the figures and facts. The statistics are worrying, right?
Currently in Nepal, I think we are somewhere in between two phases. What we have seen is we have seen a peak in Nepal caused mainly by people who returned from abroad, mainly from India. And many of the positives that we have seen so far were actually among those people coming back to Nepal. And as these returnees, the number of returnees reduced, also the number of positives reduced. What we are starting to see now is that the curve is picking up again. And so I think we are at a phase now where slowly we start seeing people who are getting infected without necessarily a direct link to travel. This is not yet widespread, I want to make that very clear, but in localized situations, in some cities, in some areas, we start seeing a number of people infected who are not really linked to any previous travel. So is the situation worrying? I think the situation has been worrying since the beginning. This is a pandemic, it affects everybody, it affects the whole world, as you know. And so it is a worrying situation, also because it's new. We don't really have any experience with this virus, how to tackle it, how to contain it, how to treat it. But as we go forward, we all learn. Worldwide we learn, we share each other's lessons, and that way, globally, there's certainly a big effort to contain the virus. And the same thing for Nepal.
For sure. Whether to have a lockdown or not is the decision of the authority or the government, to be precise. And then there will be a host of factors in its complexities helping determine the decision. Now, you as a major stakeholder in this, and with focus to the health aspect, what do you see? How do you interpret the trend and the data? Are we bracing for yet another phase of lockdown?
We had a first lockdown, and that lockdown was imposed very quickly after the second case. And I think the fact that Nepal has had very few cases in the general population, most of the cases were in people who came back from India, was to a large extent due to that lockdown. Because of the lockdown, people were not allowed to travel, people were not allowed to intermingle, and of course, the lockdown forces people to keep a distance. But the lockdown you can only keep for a certain time because it's not purely a biological thing. It also has social implications, it has economic implications and so on. We see that in all countries. After a while, governments have to release the lockdown. Usually it's done in phases, as was happened in Nepal. But if we are now seeing an uptick of cases, I can't say whether the lockdown would be, a new lockdown would be the best way to do things. I think what is important is that we keep a distance from each other, social physical distancing. We use masks when we are in an environment with many people where we can't keep these distances, or even without, but protect ourselves, protect the others. That we wash our hands frequently, that we have cough etiquette, etc. These things are very important. And if we all do this properly, then maybe a lockdown can be avoided. But if we don't do this, then maybe the government has to step in and say, well, if people do not automatically keep a distance, then we have to force them to do so. And that would be another lockdown. I cannot look into the future. I do not know what the government will decide. There are various options there, of course. If you go in a direction of a lockdown, it can be partial. It could be also localized. It doesn't have to be a nationwide lockdown. I think all that needs to be driven by how the disease is evolving and most importantly, how people are behaving.
You have been emphasizing on this from the very, very beginning,
Correct.
even in the conversation we last
Correct.
had. So let's take a quick look at the statistics. Parajanji, if we can have the projection of the statistics up on the screen. Let's take a quick look at the government statistics that we have. If we could focus on the datas of the, this is beginning January 20 and coming now to August 21. If you could see somewhere in between, beginning around the last week of May, you can see how the peak is changing its course. And this is the period when the lockdown in some way started to, get relaxed. So what is this? How do you explain this in light of public compliance?
First of all, these are cumulative figures, right? So it is a bit difficult to see on this graph what the actual curve is, how it goes up and down, because it adds every day the new cases. But what you can see in the red line is that at some points the red line goes more sharply up, and at some points the red line is more flat. And so as you can see towards the right side, at some point towards in July, the curve kind of was less steep, and now it starts picking up again. What we see is so far the number of cases, as I said, have been driven by people coming back. When the lockdown was relaxed, also the number of people coming back from India were already being reduced. There were fewer people, and so we started seeing the number of cases going down. And the lockdown was relaxed after about 3 months or so, and we all experienced it. This is a difficult period for everybody, and for some people who lose their jobs and so on, it's extra hardship. So of course you can't keep a lockdown for too long. And so the government decided after three months to ease the lockdown, because at that moment indeed the number of cases were going down, and it was also felt probably that people had understood what it meant, how they can protect themselves, what I just mentioned around keeping a distance, etc. And it is fair to do it that way, I think. It is fair to kind of see, if we now loosen the lockdown, how will people behave? But I think that if you look around you, many people actually do not keep enough distance. If you just walk around and see at shops, if you see around yourselves, people by and large wear masks. Yes, many people wear masks, and maybe that is because of the pollution. Many people are used to wearing masks, maybe. But you still see people getting together in groups, sitting in restaurants, etc., without really realizing that if there is a virus around, that makes the spread of the virus very easy. So it will be the government who has to, at some point in time, to decide, are we all behaving the way we should behave? And if we aren't, maybe then they need to impose some measures that force us to behave in a way that makes life for the virus very difficult.
That is sort of self-explained why the line has been pretty flat. But how well did the concerned agencies utilize that extra time we had? If you could explain what went wrong, why are we having this spike back?
An epidemic runs its own course. And with the measures that we have, we can try to influence that up to a certain extent, but you cannot completely be on top of the epidemic. Certainly not something like Corona that spreads very fast, that is new, that we really don't understand everything yet. In that in-between period, and people may not realize that, is a lot of work has been done. You have probably seen in the press, initially there was 1 laboratory, now there are 28 laboratories that can do that, and the capacity is further being increased by putting extra equipment in the existing laboratories and so on. That's one thing. There has been a lot of equipment, a lot of commodities like PPEs and so on that have been ordered and been brought into the country and distributed. Trainings have happened, a lot of communication has happened, the data gathering has vastly improved. The data that you just showed, this is work that happens day after day after day. So a lot of things have been put in place in that in-between period. And luckily, we have been very lucky that the people that contracted the disease so far were basically all young people, because migrants tend to be young people. And in that population, we know in this particular virus, few people actually die. Or right now, it's not yet widespread, but that may come. If we start seeing it in the general population, you will also start seeing that elder people will get affected. And we know this virus is more deadly in elder people, particularly people with underlying disease, than in younger people. So what we're going to see in the future is that we will see more cases, we're probably going to see more deaths, also proportionally, because of what I just said. The general population will get affected. And in that context, it is very important to do contact tracing. It is very important also to have things in place that people get properly treated. So in Nepal, to come back to your question, a lot of things have happened. It has not maybe been very widely in the news. More things can happen, more things still need to happen, particularly on the contact tracing side. We have had very few people who have been seriously sick, and so once more people get sick, seriously sick, of course then also the hospitals need to shift gears. But that is for the future. More work needs to be done on that also.
Right. We are standing amidst a lot of uncertainties at the moment. I sure will come back to you on the future course of things. But before I do that, if you could kindly talk me through the role and the responsibilities, of course, and the help that WHO has extended to the government and the stakeholders until now.
Our role is an advisory role and a supporting role to the government. So we do not take the decisions. It's the government that takes the decisions, and very often that is not well understood. So ultimately, it's the government who is in charge. The government makes the major decisions, and they implement and they make sure that people have the services that they need, be it surveillance, be it communication, be it curative treatment services, and so on. What we do is we work hand in hand with the government, particularly the Ministry of Health, where we discuss with them on what can be done. What is the overall knowledge around COVID? What have other countries been doing? What can possibly apply to Nepal? What can maybe not apply to Nepal? And have that conversation. And that is a conversation that goes on a day-to-day basis, basically. Our staff work with the Ministry of Health staff on an ongoing basis. Several of them actually have their office in the Ministry of Health to help out with day-to-day things, with generating data, with communication, with helping projections about how many PPEs are needed or how many ventilators are needed, and so on. So help with that kind of thing. There are, of course, a number of other partners also in the country that do also their share in helping the government react and respond and prepare for this disease.
Now, COVID-19 was recorded somewhere around the end of December 2019 in China. And then WHO declared an outbreak by the end of January 2020. And it wasn't until 11th of March, the very year, that the WHO declared a pandemic. Now, what sort of conversation have you been having with the high authorities, specifically with the Prime Minister and the high-level authorities constituted to deal with this since those very period up to now?
So the dialogues that we have had are mainly technical dialogues, technical around what needs to be done and what can Nepal do. Of course, we should keep in mind that we didn't come from nowhere. Nepal went through the earthquake 5 years ago, and following that disaster, a number of things had been put in place. There is a system of preparedness where a number of hospitals are already lined up to help out with any disaster. And so that mechanism exists. So that's something I wanted to say up front. So it's not that we suddenly started from nothing. A lot of preparation has been going on, just in general terms, not specifically for this disease, obviously, but in general terms. So the discussions that we held with the government are, with what we have already in Nepal, how can we move forward? How can we use these hospitals, the hub hospitals, as we say, and the satellite hospitals? How can we use the system of these hospitals, the people trained in these hospitals? How can we use them? We have had discussions around how can the system, the structure be built in the Ministry of Health and within the government so that the decisions are made in a streamlined fashion. How can things be better coordinated? What are the different elements that we need to think of in order to be well prepared? I remember in February, I think it was, there were a lot of discussions around bringing back a number of students from Wuhan. I think that was the first kind of big activity in Nepal, which actually brought down to everybody, what does it mean for us to tackle this disease? And at that time, a lot of discussions went around, okay, if these students are being brought back, how will we handle their return, their quarantine? Because that was the very first quarantine that was done for COVID in Nepal. I think that this exercise went very well. And then as we went further, the discussions then went also around laboratory. How can we ensure that the quality of the laboratory is good? How many laboratories can actually or should be testing? How can we scale that up? What is needed in terms of equipment? How can we do the trainings of the people working in the laboratories? Similarly for surveillance, how can we collect the data? What's the mechanism? Who's in charge? These kind of discussions are going on between WHO and the Ministry of Health around how can we be better prepared. And then of course also discussions maybe at a more strategic level around okay, the lockdown is now imposed. What would it mean if the lockdown is going to be released? Is this going to be in phases, and what does that mean? And is this going to be nationwide or localized, and what does that mean? Thinking through these kind of decisions that at some point need to be made, we were part of those discussions too. So it's basically a dialogue where from our side we try to bring in what is known in other countries, what is known globally, and match that with the reality in Nepal and bring that in as extra information so that the government can make their decision.
Everyone by now have understood that this is a new phenomenon, but have you in all this course sometime felt that this needs to be understood, you know, there needs to be newer approaches to it from all these sides? And have you ever felt that we need to change approach to deal with these new built circumstances?
In a way, it is a shift to a new approach every day. This is an unknown disease. If we would have this discussion end of last year, we would basically have nothing to say because we wouldn't know what was coming. If you look at what has been done, I think the right things have been done. The lockdown came at the moment early on in the epidemic, and I think many people were thinking, is this too early? Nobody really knew. The government made that decision because the government felt that the disease should be kept at bay from the very early moment on. In hindsight, this was probably the right decision because we have seen very few people being infected in the general population. Similarly with quarantining, I think at some point the decision was made by the government, we need to quarantine these people coming back. And there were issues with that, practical issues, yes, but by and large people were quarantined. There were questions around testing upon arrival, testing before leaving the quarantine, and so on. These were all sorted out as we moved ahead. And so a lot of things, you basically in this epidemic, you move forward without, as the situation dictates you, basically. That is basically what's happening. And the same thing will happen as we further move forward around what is next. Well, we have to see how the disease evolves and then take measures so that as few people as possible are infected and as few people as possible die of the disease.
What can the people do when there is this widespread community transmission?
I want to stress again, at this moment, the transmission that we see in the communities is localized and is not yet widespread. With widespread, I mean the whole of Nepal is affected, and there we are not yet. So I want to make that first clear. But in terms of the disease further spreading, there is certainly a very high risk that will happen. and that it starts spreading from one community to another, there's a serious risk that that will happen in the near future. What needs to be done? Well, what we have been saying all along. Keep a distance. If you stretch out your arm, you can touch somebody, you're clearly too close to the person. We are saying at least a meter. If you can do it more than a meter, it's better. Wear masks, particularly in situations where there are many people around. For example, if you sit on a bus or when you are in the market and so on, where sometimes it's not possible to keep a distance. Wash your hands very frequently. When you cough, don't cough onto other people, cough in your elbow. These basic measures are things, and sorry I keep on repeating this, but these are key to keeping the disease under control. And if all of us, we can do this properly, then we can potentially avoid another lockdown. If we don't, then maybe the government has to step in and say, well, if nobody respects the rules, or not enough people respect the rules, then we have to force people to respect the rules. So it is going to be a matter of our behavior in how far we can slow down the disease.
And what will be the roles and responsibilities of the government and the WHO in case of community transmission?
In terms of our role is of both the government and WHO is, first of all, make the people aware what's going on, and that's what we're trying to do here. I think when people started seeing the cases coming down about a month ago or so, I think quite a number of people thought, oh, we have had the worst. Actually, that was not the case. We did not have had the worst because most cases were among returnees. There is very little immunity against this disease in the population because it's a new disease. And so the risk of people getting infected is there. And again, our behavior will determine how big or quick that risk will play out. So what can WHO and the government do? One is making people aware of that. But secondly, also making sure that if there are people who are infected, that their contacts are quickly identified and traced. The reason why we are interested in knowing who is infected is not because of some scientific reason. It is because somebody who is infected can spread the disease. And you want to isolate that person from the rest of the population, from the people around him or her, and from the larger population. And that's why we need to know who is infected. And knowing the case is only part of the picture. If somebody tests positive, we know this person is positive. And so that is part of the picture. But we need to know also if that person has already infected other people. Why? Because these other people, in turn, can also spread the disease further. And therefore, this contact tracing is very, very important. Not to make these people scared, no, but to make sure that if these people exist, if there are other people who have been infected, that they also don't spread the disease further. So that is very important, and the local authorities have a lot to play there, a big role to play, because this is a lot of detailed work that needs to be done. Asking a patient, who were you in touch with? Asking the phone numbers of these people, contact these people, talk to these people, etc. There's a lot of work that goes with that. And so the local authorities are best placed to do that. It is impossible for the central government to send teams all over the country to do contact tracing because that is simply too many. So contact tracing is certainly something that needs to happen and will need to be stepped up as we start seeing more cases. We need to continue to collect the data. We need to make sure that our lab capacity stays at a high level. I think right now we're okay. Recently the government came out with new testing guidelines, and I think they also opened the door for much wider testing, which is good. So all these things go hand in hand to basically be prepared, including the hospitals, obviously, when people fall sick, that they have a bed to go to, that they have a treating physician, that they have nurses who can take care of them. This is a disease where when you fall sick, the vast majority of people will not need to go to a hospital. 80% of people who have the disease have mild symptoms. They can simply stay at home, they should make sure that they don't infect other people at home or their neighbors or so on. But if they stay at home, from their own health point of view, they're fine. It's like you have a flu or you have a cold or something like that. You don't need to go to the hospital. But 15% needs to go to the hospital because 20% needs to go to the hospital, of which 15% just needs some oxygen, and the other 5% may need more intensive care. So it's about 1/5 of everybody infected actually only needs to go to the hospital. But these hospitals need to be ready with enough oxygen, with ventilators, with ICUs, and with trained health personnel to actually give the right treatment.
Despite, some significant achievements in the side of contact tracing, we've also been hearing a lot of stories which clearly shows that it's been a struggle for the government at many point of time, given some technological hindrance, the other, people not abiding or complying by the rules, sort of this. So in this light, how do you think the government should go about the contact tracing in the scenario that we'll have a community transmission?
Yeah, I think there are a couple of things that can be done. One is communicate to everybody how important contact tracing is. We see also in other countries that sometimes people are reluctant to give their contacts because they don't want their friends to get into trouble, they think. But that's not the issue. It's not a matter of getting into trouble. Nobody's getting into trouble. On the contrary, you want to give the names, you want to give the phone numbers so that they can get tested and they wouldn't spread the disease any further. So a general awareness is very important. At the same time, as I mentioned, the local authorities have a role to play. But also I think what is possible is to bring in volunteers. Volunteers who can do a lot of the groundwork. We will need a lot of people to actually follow up these contacts. Once we have more and more cases, if every case has 20 or 30 or 40 contacts, all these people need to be traced and contacted on a regular basis to make sure they don't fall sick. It's not just one time, because you want to check after a few days again whether they haven't fallen sick yet. So that will require a lot of manpower. And I don't think the government will have that manpower. I think we need to bring in volunteers who can help out with that and who are willing to do that work in coordination with the government. The government has to give the instructions, they have to coordinate it, but at central level, but particularly at local level, with the help of volunteers.
Certainly the stress is on coordination and a synergy, that needs to be created. But, coming from some of my conversations with the stakeholders, they have raised concerns, concerns, I would rather use that word, over, the federal structure in Nepal being in its infancy, which has certainly created a problem, in creating that required synergy. So what has been WHO's observation, especially in the light that we are talking about the role of a synergy at all levels?
Yes, I think the country, as you say, is going through the early phases of federalism or a federalized state. And not all structures are in place yet. A number have been put in place in the last 5 years, but not everything yet. And if we now have this crisis, which comes on top of everything else, it of course stretches the system even more. And so I think things need to be adjusted as we go forward. Particularly because not everything is in place yet in this federal system. The central government plays a role of coordination, a role of bringing all the pieces together, and of guidance, of overall guidance around what is needed, what are the standards, what are the guidelines, and so on. The provincial and the local governments, they have more an implementation role. They are closer to the population and they have more that implementation role. And that coordination needs to happen on an ongoing basis. I know that there are weekly video conferences with the provinces, for example, and the central government to precisely discuss these things. Then there are, of course, also numerous informal talks, if you like, for specific problem solving and so on. But the coordination is indeed very important. And the country being at the early phases of federalism, that certainly complicates things. That's for sure. It complicates things. But at the same time, I think everybody is willing to work with the various levels to make things work. That's not always easy, and there will be certainly gaps because this is not yet a well-established system. But what is important is that there is a willingness for all the levels to work, and that has led to peaks that overflow the laboratories. That's correct. And we have seen during a period of time delays in getting the results, simply because the laboratories were overloaded. Will that happen again? It may happen again. It's always a balance between how much capacity do you have and how many tests do you need. I think where we stand right now, I think we are kind of all right now. But going forward, there will be a need for more tests. But as I said, also the capacity is being scaled up. The idea is, of course, that you would get your test very quickly. The idea is not that you get your tests after a week. You would like to get your test results within a day, ideally. So that should be the aim, that the laboratories are being scaled up to such an extent that the tests results can be available within 24 hours. That should be the idea.
Now, what are the challenges on the field, and how are you working with your partners to improve the health service and speed the path of recovery?
Talk about the lab maybe here again, the quality of the labs. There are we're working with laboratories to put in place quality assurance mechanisms. They are kind of double. One is an internal one where the laboratories around the country send samples for double testing or checking to a centralized laboratory, to this kind of internal quality check. And then we're also setting up a quality check with outside laboratories, which send in panels, which send in basically samples of which the results are known already, as an exam, if you like, for the laboratories here to see how well they're doing. So these quality checks are being put in place to make sure that the results that come out of the laboratories are reliable. So that is being worked on to make sure that we know that if a result comes out positive, it is positive, or if it comes out negative, it is negative.
Right. And what about the rest of the health service sector, given, I mean, I'm talking about the hospitals, the capacity, relating to the infrastructures. How do you see that?
Yes, so we have done, together with partners, assessments of key hospitals. So the government has designated a number of hospitals as COVID hospitals. We have done assessments of these hospitals in a number of areas, like infection prevention and control. What measures are in place that if there is an infection, it is the basic hygiene is there so that the infection doesn't spread. But also around the curative care, is there enough equipment, etc. So we have done these assessments. Of course, that was in collaboration with partners and with the government. And that is one way of setting a baseline to see what is actually in place. And then the government takes that and acts on it so that these hospitals are better equipped. That measures are being put in place, that staff are better trained, and so on. So this is something that has happened already, but is also something that continues to happen. This is not something you do once and then you say, now we're done. The disease is evolving, training hospital personnel again, putting new procedures in place, coming up with new guidelines and so on. All that takes some time. That is in process. So that when people need care, that the hospitals are ready to do so.
And there's been quite a hullabaloo over the virus strain and, you know, the Nepali immunity and sort of thing. So first, please talk to me through the strain of the virus prevalent in Nepal. Have we had any genome sequencing that has come to your knowledge?
Yeah, so first of all, it is a myth to think that the virus in Nepal is a different one from elsewhere in the world. We have no evidence at all to say that. Globally, on an ongoing basis, the virus is being isolated and checked and so on. And there's a database, I think currently over 70,000 samples have been checked and to check on how the genomic sequence changes. in general, with a virus like this, it's normal that if you check the genome, that there are small differences. That happens with viruses like that all the time. But what we haven't seen yet are big changes. So our current understanding is, and I'm talking now about the global level, is that the virus hasn't changed much. We have no evidence to say that there are certain strains that cause more severe disease or that are more aggressive and infect more people, for example. We don't have evidence to say that. What we do see, and I think everybody knows this by now, is that the virus circulates more if you have more people in a room, if there's not enough ventilation, if people don't keep a distance and don't wear masks. That makes the virus spread more. That has more to do with our behavior than with the virus being different. So that these two different things. The virus is the same, but if we behave differently, the virus is going to behave differently and can spread easier. Similarly, on the severity of the disease, there are not, as far as we know, no viruses that are causing more severe disease. What we know is that if the patient is older or the patient has underlying conditions, there is a higher chance of the patient developing more severe disease. That again has nothing to do with the virus, it has to do with the patient. So in general, the virus, yes, there are small changes occurring in the virus if you look at this at a global level, but not to the extent that the virus starts to behave in a different way. That not yet. Now, why is this important? It is important because something happened when this virus jumped from an animal to a human. So there was some mutation, as we call it, something changed in the RNA of the virus, happened at that time. And so it is important that globally we keep an eye on that virus. Is the nature of that virus still the same, or is it changing? Because if it's changing in a major way, it can go in different ways. It can become a virus that is worse. It can also become a virus that is weaker. And so we need to keep an eye on these kind of changes. Coming back to Nepal, the same thing has happened for the rest of the world. The virus in Nepal is not different from anywhere else. We have had one virus sequenced before the lockdown that showed that actually the first virus in Nepal was the same as the Wuhan virus. I think that currently some people in Nepal are also trying to sequence the genome of the Nepal virus, and we will certainly, or they will certainly compare that with what is known about the other viruses in the world. And I'm pretty sure that what we will see is minor changes, but no major changes.
This question is leading to the one on Nepal's immunity, coming from their lifestyle and food. Even Prime Minister Oli went on to endorse the alternative medication and precautions or precautionary habits. You are a medical doctor yourself. What is your statement on this?
From our point of view, it has all to do. The few number of deaths that we've seen in Nepal has all to do with the population that has been positive. The people who have been positive, we saw on the screen, there are now 21,000. Over 90% of those are among people who came back from abroad. Most of them being migrant workers, people who went to India or to the Middle East, but particularly to India to work. And who goes to work? There are mainly young men, men between 15 and say 40 or so, who are in the prime of their lives, who are strong, and they go out to work. And in the Nepal context, these are mainly men who go out. And if we look at the statistics again of the people who tested positive, we see the same profile. The vast majority of people who have tested so far positive in Nepal are young men. And the important here is young, because as we know for this disease, in young people, this disease is mild or even asymptomatic. Asymptomatic means there are no symptoms. People don't even know they have the disease. And we've seen that in Nepal. Many people who tested positive didn't know that they were carrying the virus. And we see that in younger people. So it has all to do with the population that has been tested and that has been tested positive. Most are young men, and if you would in any country test young men or young people under 40 or so, and they test positive, you would also have a low death rate. This disease kills more older people and people with underlying conditions. And typically, people wouldn't go to India or to the Middle East if they have a serious underlying condition. So you have a group of people who are young and healthy, and in that group, the disease hardly kills. And that's what we have seen in Nepal.
Now, if I recall from day one again, you've been stressing on public compliance of the health safety protocols. And I have a list of questions who is coming out of curiosity, and I'm sure our audience would love to hear this from you. As a WHO representative, how are you adopting precautionary measures in your day-to-day life? Right.
This is an interesting question. Keep a distance. That's the main rule. We are sitting here at least 2-3 meters. So the chance of, if I'm sick, of infecting you or vice versa is hardly existing. So keeping a distance. I do that also in my office. If people enter in my office, we keep a distance. The person who visits me sits in one corner, I sit in the other corner. When we have a meeting with several people, we don't do that in my office if we feel it's too small, where we can't keep a distance of at least a meter, but we use a meeting room to do that. In our office, a number of people work from home. A number of people work in the office, but we have reduced the number of people in the office to make sure that distance can be kept between everybody working there. And then, of course, there are also colleagues working in the government premises. I wear a mask when I go out. I wear a mask when I feel there are too many people around. When I walked in here, I was wearing a mask, but I took it off for this interview. But because in this context, I don't think talking to you, there's a need for a mask because we are far enough from each other. I wash my hands very regularly. I turn away when I need to cough. So basically, I try to put in practice what I'm preaching. But I also realize it's not always easy. It's sometimes you get caught in situations where suddenly there are 3 or 4 people standing around you and you don't really realize that is happening. Well, if you realize it, step back, try to create some distance, put on your mask, and be conscious of what's happening. But at any given moment, as much as you can, keep a distance. That's very, very important, and wear a mask if it's needed. Yeah.
Right, it's very easy, I mean, easier said than done, right?
Yes.
Because once you get to your normal chore, it's
Yes.
kind of really difficult to
Yes.
be that tactful. And I have brought this mask, which I see majority of the people wearing. So, what is this the appropriate one that people should be wearing, or are there any specific recommendations coming from the
Right, the one that you're showing is what we call a medical mask or a surgical mask. Which is good, yes. So basically you have 3 kinds of masks. At the top level you have what they call N95 masks, which are like closing on your face. And those are actually recommended for people who work in situations where there are very small droplets. And that is typically in ICU. So you and me or everybody else having an N95 mask is actually overdoing it. That is needed in ICUs. The medical masks are fine, and then because they basically stop a lot of the droplets. But WHO has also been saying that cloth masks are fine, particularly for the general public going out. Knowing that they don't stop as much the droplets as the medical masks. But the importance of the cloth masks is that we may face a situation that at some point in time there won't be enough medical masks available. And what we want to make sure is that the people who really need them, and that are people in contact with patients, mainly health workers, but also patients themselves, positive people, they need these masks so that they protect themselves in a true situation of being in contact with somebody who's infected. And so for a situation where we risk of running out of these medical masks, there certainly cloth masks would do for the general public, for people going out in the street and so on.
Right. Besides the masks, there are, are there any specific protocols that you follow for activities like, going for grocery shopping or the likes?
Yeah, the grocery shopping, I don't do it all that much myself, but yes, when you go to a shop, the same thing applies. And again, I realize very well that you very quickly end up too close to people. And for me, it is often a way to kind of judge, am I too close, is that, can I touch somebody here? If I can touch somebody, I'm too close. So then I try to take a step back. If you go grocery shopping and it's a small shop in the street, usually you can keep a bit of a distance. Same thing if you go to a supermarket or a place where there are more people. You have to pay more attention because it's quite easy to get too close to people. But it's basically a matter of being constantly aware and asking yourself all the time, am I too close here? And if you are, do everything you can to kind of keep that distance.
Right, and as we come to the close of the interview, Dr. Jas, here are a few questions or comments that I received on the social media sites.
Sure.
Right, there are a few things that have come up. I would pick a couple of them. One says there is a need for more significant visibility of WHO from being just a mere observer.
One is we're not an observer. We work very closely with the government and we work very hard with the government to help in responding to this pandemic. And this is for Nepal and this is globally. As I said earlier, we are an advisor to the government, but our job is to do that, to advise the government. The government is the decision maker, the government is the implementer. And so in that sense, it is not up to WHO to be in the forefront of what's happening. That's the government. The government is in charge, and they take the responsibility. They take the decisions, and they are the front, the face of what is happening in this COVID response. We, as WHO, are behind them to help them. To help them think through what needs to be done and how things can be better prepared. But it's not up to us to be in the forefront all the time. We try to do our job. We try to, through interviews like with yourself, try to explain what we're doing. But it is not visibility, yes, but up to a certain extent.
Right. And then there are a couple of interesting ones here. I think this is relating to the global context, Dr. Jas. It says, why did WHO change its stance over a couple of issues? One is in saying asymptomatic people are unlikely to spread the virus. The second is on saying airborne transmission is possible. Now, having said that, the person further writes, now the WHO is saying both the vaccine and the old normal will never come. So how likely is it to shift from this position in the future?
All right. Yes, it is true that WHO has shifted its position on a number of things. It's true. The masks is an example, but that has been mainly because of changing science. We learn about this disease every day, and what WHO does is it basically collects the science that's available, and usually that is through published articles, that is through government reports and so on. And from that, it tries to form a picture around what does the science say. And sometimes science contradicts itself. Sometimes you will have one group of researchers that find something, and another group of researchers finds something else. So it's not always black and white. WHO tries, at a global level, tries to bring these elements together and come to some kind of a conclusion which then translates into an advice. Now, the examples that you gave are slightly different, because I think there have been some misunderstandings there. The issue of asymptomatics not transmitting, WHO has corrected that immediately. There was a reference to some studies, and the way it was worded was wrongly worded, and it was misunderstood as WHO saying asymptomatics don't transmit the disease. Asymptomatics can transmit the disease. WHO still saying that symptomatics transmit it more, but asymptomatics can transmit the disease. And so that was a bit of a misunderstanding. Around the vaccine, there are more than 100 vaccines in the pipeline. Again, this is not WHO doing this. This is WHO only trying to understand what's going on and coordinating and putting the whole picture together. These are other groups of people developing the vaccine. It's very difficult to say at this point in time which of these 100+ vaccines in the pipeline will actually work well. Because, of course, we often focus on in the news about, oh, there is a vaccine in the pipeline or so on, but of course it has to be safe and it has to work properly. It has to protect enough people. If you have a vaccine that maybe has only 20% protection, is that worth it? That's a big question mark. So, and of the vaccines that are in the pipeline, we don't know that yet. And of course, everybody is very anxious to know when we will have a vaccine, because then we can go back to the old normal, we hope. Very hard to say. Usually it takes many years to develop a vaccine. For this vaccine, a number of processes are done in parallel. For example, factories are being built to produce the vaccine without having the vaccine yet, for example. If WHO makes statements around when will we get a vaccine, it's an estimate, it's a guess, because we don't know yet. Some scientists say we will have a vaccine before the end of the year, maybe. Others say before the end of next year, maybe. We don't know. And so we live in an environment with many question marks. And what WHO tries to do is try to make some sense out of this, because there is information that's coming in all the time, and some of that information conflicts with other information. And how do you then figure out what is more likely the case than also otherwise? And so if it looks like what the science first said, and WHO came up with guidance, seems to be based on wrong studies, or the disease has evolved and we understand better what this is, then WHO changes its advice. And I understand that is sometimes confusing, but that's the way it is. We are in a situation where there are many unknowns, and we have to adjust as we start to understand more. We have to adjust how we act.
Right, and the international scramble, the ongoing international scramble over this vaccine is, I believe, as unprecedented as the virus and the pandemic itself.
Of course.
Thank you very much for spending your very valuable time and also your very valuable insights and perspective to us.
Thank you very much. It was my pleasure, Shivani. Thank you very much.
Right. And dear viewers, that's it coming to you from this edition of this pandemic special. So until we see you next, stay safe and do comply by the health safety protocols. From me, Shivani Thapa Bosted, and the entire crew, goodbye and namaste.